is at a high risk level. Africa, the Americas, the Eastern Mediterranean region, and Southeast Asia all at the moderate risk level. And then the Western Pacific region is at a low to moderate risk level. So the next slide, please. So this next slide that is about to come on is shows the case reports by countries for top 10 countries. So the top 10 most affected countries globally are the US, that has over almost 20,000 cases, Spain at about 7,000, Brazil at 5,500, France, Germany, the UK in the 3,000 ratio, Peru almost getting to 2,000, Canada, Netherlands, and Colombia in the 1,000 caseload. Together, these 10 countries that I have just mentioned account for 87.5% of the cases globally. With all this, information, I think I would like to say there's some good news. So maybe some light at the end of the tunnel. And the good news is that the reported new cases have decreased by 25% in the last 1 week. So comparing the week of August 29th to the week of August 22nd. The majority of cases in the last 1 month were reported in the Americas and in the European region. In the Americas, it's over 70%, and in the European region is almost at 30%. So the next slide, please. So what is the response? And you hear more again from my colleagues. So the response is really around prevention, awareness raising, treatment, vaccinations, infection control, reducing the risk of human-to-human transmission, reducing the risk of zoonotic transmission, and putting embargoes. Some countries have put embargoes and have put in restrictions on animal trade to really help to mitigate the spread of monkeypox. The next slide, please. So I'll just end by talking about the current global program response, because Dr. Iwe has mentioned that I do, participate and part of the team looking at what's the global response from the United States and all over the world. And, the response is really focused on, research to speed the global response. Like I said, there's so many unknowns, and research is really a priority. Conducting observational studies, supporting the next generations of therapeutics, supporting vaccine supply and delivery, building capacity to safely and effectively prevent, detect, and respond, and supporting surveillance. So I will stop there, and I would really ask you to sit down. I hope I've given some just general overview, and in the next 40 minutes, our esteemed speakers will provide you with important information about this virus. Thank you, and I think I will turn it over to Dr. Prachi Ranade to start her presentation.
Good morning, good evening, everyone.
Sorry, Dr. Prachi, we just had a couple of polls. I'm so sorry. Just to know who's in the room, and Dr. Prachi, you had asked, Jamie, can we find out, do we have questions? Like how many doctors are in the room? Jamie, is the poll working?
Yes, it's working.
Okay.
Yes.
Okay. Co-hosts, please don't fill the poll. Co-hosts, please do not fill the poll. So we just have to find out how many doctors were in the room. So co-hosts, please don't fill the poll. Okay, and then Jamie, are we ready to go to the second question? Okay, how many people know somebody who has monkeypox or have had monkeypox? Dr. Prachi, I'm sorry, it looks as if Dr. Adedifa, the NCDC Director General, is in the room. I hope you wouldn't mind if he speaks first.
No, not at all.
Because I think,
do you want me to stop sharing my screen?
Yes, please, if that's possible. Dr. Adedifa, are you ready?
Yes, I am. Thank you.
Okay. Thank you so much and congratulations. We have not met you in your new role, so congratulations on this new job of looking after 200 million people and protecting them from all local and global virus diseases. So we're really very excited that you have been able to join us. So we look forward to your perspective on some of these issues from the Nigerian perspective. In the meantime, please, if there are any questions for either Dr. Achebe so far and now for Dr. Adedifa, please put it in the chat box. Thank you.
Just to check, are you seeing the right view of my presentation?
Yes, we can.
Okay. All right. Thank you very much for the invitation to speak at this webinar with a really apt overarching theme. And I've been asked to speak briefly about monkeypox in Nigeria and the current situation and our response plan and activities at the Nigerian Center for Disease Control. I think, as has been highlighted by earlier speakers, we do have half a century worth of experience with monkeypox, but for 40 years of that time, we sort of had a disappearance, quote unquote, and then we had a resurgence since 2017 that has sort of informed what has been a steadily and increasing and robust response, which again adopts or lies on the premise of a One Health approach, which is what we are mandated to do in our role of preparing for emergencies and responding to them. However, as I've been highlighting to colleagues here, while we're familiar with monkeypox this year is different. So I think this is a different outbreak, and there are probably a few reasons for that. I just want to quickly go next to some of the milestones. Well, as people know, at the NCDC, after a national risk assessment or joint risk assessment, as we call it, the National Monkeypox Emergency Operations Center was activated on 26th May 2022. And this was, of course, before all of the more international drama. And then, of course, that was followed up later by WHO's declaration of the current monkeypox outbreak as a public health emergency of international concern. Before the activation of the Monkeypox Emergency Operations Center, the preparedness and response to monkeypox was looked after by the Monkeypox Technical Working Group. So we've got technical working groups for all the diseases that are under our purview. And even when we're not in crisis mode, these guys look after everything to do with preparing and responding to those conditions. So the EOC, activating the EOC meant that we were ramping up the level of alertness, and then we were bringing about sort of a stronger coordination of the response along the usual pillars of risk communication and community engagement, surveillance, infection prevention and control, which was mentioned earlier. Of course, case management, point of entry, because you're typically concerned about the possibility of travelers bringing in the disease of interest or you exporting, and of course, strengthening laboratory activities. And as has also been highlighted, identifying research priorities that are relevant to the public health response. So as at a few days ago, this is what the monkeypox situation looked like in the country. We've had 815 suspected cases, and now 318 confirmed cases from 30 of 36 states where we've seen suspected cases. And sadly, we've had 7 citizens die, giving a case fatality of about 2.2%. The epic curve to my right just shows how the reporting of confirmed and suspected cases every week, and we can see that in the last 3 weeks, especially from week 33 to 35, the numbers have steadily gone up. So the sort of reported global decline is not aligned to our observations here in country. We've steadily reported more cases week on, week out. And this just gives a sense of where we are getting monkeypox from. A lot of concentration around the south, and of course, Lagos is leading in terms of the reported number of confirmed cases at the moment. But we are also quite conscious of these 0 reporting states. They have all reported suspected cases, which is good. They just haven't had a confirmed case. But of course, it's a bit difficult to believe that, for example, Ekiti, in the middle of everybody else in the southwest, or Enugu, also with states with cases around it, do not have a case. So we are looking into that with an intention to either work with our state colleagues to do some form of active case finding, but just to check that reporting of suspected cases is as it's expected. Okay, so just to move to the next one, talking about specific response activities, you know, at the moment, in recognition of the increase in number of cases in Lagos in particular and other parts of the Southwest, we are now going to commence monkeypox testing and diagnosing in Lagos, hopefully from next week at our other reference lab campus, the Central Public Health Laboratories in Yaba. There are colleagues, of course, working on strengthening infection prevention control. This is not just about monkeypox, but again about COVID and every other communicable disease that that we need to ensure that the health setting remains safe for both staff, for healthcare workers, and the patients that come. We are working on changing the guidelines in terms of the case definitions for the suspected case, given especially given what we've seen about chickenpox being a close differential diagnosis of monkeypox in our part of the world. And because we are used to seeing chickenpox commonly, especially in adults, given that we don't have a vaccination program for chickenpox, it's assumed that, you know, this is the usual self-limiting chickenpox that we all know. But we now know that when you look at all of the suspected samples from all of the suspected cases that we've tested for at the National Reference Lab, half of them, almost half of them truly have chickenpox. The other half have, almost half again have monkeypox. But we also now are identifying a smaller group of people who actually have both monkeypox and chickenpox. And because